You got a prescription for the shot, and now you've replenished your wardrobe with smaller clothes. Then comes the bad news. Either your insurance no longer wants to cover your medication for weight loss, or you have side effects that make it intolerable. Without making changes, you will gain all that weight back. You lost weight with the shot. Now what? You're listening to Healthy Looks Great on You, a lifestyle medicine podcast. I'm your host, Dr. Vicki Petz Casper. For 2 decades, I practiced as a board-certified obstetrician-gynecologist, navigating the complex world of women's health. But life took an unexpected turn when my own health failed. Emerging on the other side, I discovered the transformative power of lifestyle medicine. Now, I'm on a mission to share its incredible benefits with you. So buckle up, because we are going on a journey to our very own mini medical school, where you will learn how lifestyle medicine can help prevent, treat, and sometimes even reverse disease. This is episode 126. You lost weight with the shot. Now what? Early during the pandemic, we saw people with obesity were especially vulnerable to morbidity and mortality associated with COVID-19. That led to an outcry from the public. Why isn't anyone talking about the obesity epidemic? Okay, let's talk about it. Doctors and patients know that being overweight puts your health at risk for so many things. And obesity is considered a chronic medical condition that requires ongoing treatment. The CDC defines obesity as weight that is considered higher than what is healthy for a given height. The World Health Organization defines obesity as excess or abnormal fat accumulation that presents a risk to health. And though there's been some recent talk about tossing out BMI or body mass index, it's still used to categorize weight because we've used it a long time, so we have a mutual understanding. It's easy to measure, it's reproducible, and although it may overestimate in some really buff people, it's generally correlated with a % of body fat. BMI is calculated by dividing your body weight in kilograms by your height in meters squared. You likely know your weight and height in pounds and inches, but there are handy calculators online, and I put a BMI calculator in the show notes in case you don't want to do the math. But here are the ranges. Normal weight is considered greater than 18.5 to 24.9 kilograms per meter squared of BMI. Now, if it's greater than 25 but less than 30, that's considered overweight. And if it's greater than 30, that's obesity. And obesity is further classified into Class 1, Class 2, and Class 3. Class 1 is 30 to less than 35. Class 2 is 35 to less than 40. And anything greater than 40 kilograms per meter squared is referred to Class 3 obesity, also known as severe or extreme obesity. And waist circumference is super important too, because abdominal obesity is worse for your health than if it's behind you where you don't have to look at it. So use them both. Waist circumference that exceeds 40 inches in men and 35 inches in women is considered to be abnormal and a risk factor for complications associated with excess adipose tissue. And listen, there's no need to measure a waist circumference in people with a BMI greater than 35. We already know they are at risk. But people with a BMI less than 35 can also have an increased waist circumference that puts them at risk. No matter who you listen to, obesity is considered a chronic disease and a global epidemic. It contributes to disability, disease, and death. And the prevalence is going in the wrong direction, not only in the United States, but throughout the world in both children and adults. From the time I graduated from college until now, the overall incidence of obesity in the United States has doubled from around 22 to around 44%. And the future doesn't look too slim either. Projections suggest that within the next 5 to 6 years, about half of all adults in this country will be obese and a quarter will be severely obese. What's causing this trend? Well, lots of different things, and it's likely multifactorial, but some medications, early feeding practices, societal eating patterns, the standard high-fat American diet, oversized portions, depression, thyroid disease, socioeconomic disadvantages, age, inactivity, and genetics. And like I said, it's more likely a combination of several environmental and genetic factors. But the problem isn't just body image. Obesity interferes with the ability to enjoy an active life. It can be hard to breathe if you're stuffed into your clothes. Taking the stairs, walking, or bending over are more of a challenge. Excess weight is hard on your joints and, more importantly, your heart. There's an increased risk of many diseases like diabetes, fatty liver, high blood pressure, and even cancer. Life expectancy is shortened in people who are obese compared to those at a healthy weight. So yeah, we know it's important, but what do you do about it? Well, first of all, it's not eat less and move more. And side note, it's just really hard to lose weight with exercise alone. What you eat is far more important in contributing to weight management. And of course, you should reduce calorie intake and increase calorie consumption through exercise. But people, it's hard. So what is the best diet for weight loss? Well, some people say the one you can stick to is a pretty good plumb line, though I'll take exception to some unhealthy diet trends. In a future episode, I'll review the current diets and their virtues and vices. Same goes for exercise. Get moving with something that works for you. Though it's a horrible oversimplification, the combination of a healthy diet and physical activity is the best formula for weight loss. Now, this is true whether or not you're having surgery or taking medication to help. You may wonder where you're getting unhealthy excess calories in your diet. Or on the other hand, that empty box of ice cream sandwiches may be the only clue you need. But try logging everything you eat. I recently did this and it was eye-opening. A little here and a little there adds up. And if you keep a food diary, that can help you be aware of it. Especially look for these bad actors: sugar, sweetened drinks. Avoid drinking your calories. And some people can lose weight by substituting high-calorie beverages for water. But water by itself doesn't really help you lose weight. One thing all successful diets have in common is getting rid of processed foods, especially those high in unhealthy fats. Remember, a gram of fat contains 9 kilocalories compared to 4 for carbohydrates or proteins. A healthy diet should include a variety of whole grains because they trap calories and move them right on out of your body. Portion control is important, so is developing a healthy relationship with food. Sugar is addictive, and the treatment for addiction is generally abstinence. Of course, you can't abstain from food, but you can eliminate or reduce processed foods and sugar. And here's the deal. If you do it for a while, you'll realize how bad it makes you feel, and you'll be more motivated to keep away. If you change your eating or exercise habits for a short time, you might lose weight, but you'll gain it back as soon as you go back to your old habits. Weight loss is about changing your habits for the long term. Making healthy lifestyle changes is sort of the whole point of this podcast, but it's more complicated than most people can even imagine until they try to do it. I'll have more information on upcoming episodes about how to make lifestyle changes, so I hope you'll stay tuned. In fact, I hope you'll subscribe to my email list. If you do, you'll get some extra goodies. Just go to my website, www.healthylooksgreatonyou.com. Of course, I'll put a link in the show notes too. You need nutrition, so eat. But eat food that is nutrient dense instead of calorie dense. I don't really recommend counting macros, but I do think you should read labels so you understand what you're putting into your body. And if it's a chemical name you can't even pronounce, then it's probably not good for you. A whole food, plant-predominant diet will supply all the protein, carbohydrates, and healthy fats you need, with one exception. Vitamin B12 is not found in plants. So people who eat exclusively plants need to take a supplement. But a variety of fruits and vegetables will give you all the other essential micronutrients that you need. Remember those old Alka-Seltzer commercials? No, not plop, plop, fizz, fizz, but the guy moaning after a dinner party. I can't believe I ate the whole thing. portion size matters. But how do you control portions in a supersized society? Number 1, eat at home. Filling your plate at home will usually result in a smaller amount than if you go to a restaurant and let them pile it on. Number 2, if you do eat out, share your dinner with your dinner partner or ask for a to-go box and put half away, even if you don't plan to eat the leftovers. And skip the appetizers. They are packed with calories. Choose menu items that have fruits and vegetables and try to fill up on the good stuff. Number 3, decisions. Good decisions are made intentionally. So decide in advance. That means grocery shopping, meal planning, prepping. And if you know you're going to be in a situation where there will be a large selection of unhealthy food, you don't have to deprive yourself of cheesecake. Just decide in advance the number of bites you will take. Then put it away. Let's face it, some people have a good set of self-regulation skills when it comes to eating, complete with the support they need to implement lifestyle changes. Other people need more help, sometimes to the point of cognitive behavioral therapy. This includes help with goal setting and figuring out what barriers there are to reaching those goals. It helps if you can identify what triggers overeating or unhealthy behaviors, then come up with solutions to mitigate and overcome. Do you weigh yourself? If not, why not? Listen, the number on the scale is just an effect of the relationship between you and the Earth's gravitational pull. That's a new way of thinking of it. But you don't want to wait until your weight is going up and your clothes are too tight to realize you're moving the needle in the wrong direction. Personally, I think regular weighing is helpful, not to see if you've lost weight, but to make sure you haven't gained. And if you're trying to lose weight, jumping on the scales every day can be discouraging. Either way that works best for you, remember, your weight on a single day can vary greatly, so look at trends instead. This is an example of self-monitoring, and it helps some people, but others need someone else to hold them accountable. If you're good at self-regulation, or if you just want to identify some of your strengths and weaknesses and barriers to success, I have a 7-day prescription for change, which is a little mini course that you can take, complete with a workbook, and it's free. And all you have to do is sign up by email. I'll put a link in the show notes, or you can go to my website to find it, healthylooksgreatonyou.com. Other aspects of lifestyle medicine are important too. Social connectedness promotes healthier behaviors in most people. Isolation is not good for your health or your weight. It actually alters leptin levels, which are important in appetite control. Social connectedness can give us the support we need to meet our goals. Boredom causes some people to head to the pantry. I never understood this until the pandemic, and I don't think I was alone. Many emerged from the days of quarantine with some unwanted extra pounds. Social connectedness can also help reduce stress. And we know that stress increases cortisol levels, which can cause excess weight gain, especially that aggravating belly fat that is so bad for your health. Managing stress is an important component of maintaining a healthy weight. And the way not to manage it is with alcohol. There are lots of consequences that come with drinking alcohol, not only to your health, but relationships and simply productivity in life. Besides, it's empty calories. A glass of wine contains 120 to 165 calories in a 5-ounce glass. Beer is around 150 to 200, and even light beer is about 100. And it usually goes straight to the gut. I mean, they don't call it a beer belly for nothing. Most hard liquor is around 100, and don't forget to multiply that by the number of drinks consumed. Another aspect that is really starting to be recognized as a huge impact on our health is sleep. And guess what? It's all related. Your diet, activity level, alcohol consumption, stress, and relationships can all affect the quality of your sleep. I hear some of you saying you've tried everything to lose weight and nothing works. The risk of long-term obesity to your health is significant. Surgery is not without risk, but generally outcomes are good. But only if you implement lifestyle changes too. A good bariatric program will address the social and behavioral components as well. Now, let's talk about the medications. There have been many different classes of medications for weight loss over the years, and most of them had the potential to cause scary adverse complications. But now we have a relatively new class of drugs, and yes, there are definitely risks, but also a lot of benefits. Who should take them? People who have not met their weight loss goals by 3 to 6 months and have a BMI greater than or equal to 30 kilograms per meter square, or people with a lower BMI, above 27 but below 30, who also have a weight-related health problem, like diabetes or high blood pressure. And these drugs work. Studies show that anti-obesity medications typically result in a 5 to 22% weight loss. But there is a caveat. This is when combined with lifestyle modification. Let me say that again. Weight loss drugs or surgery work when combined with lifestyle modification. Even the package labeling says it. Let's look at the package inserts. Mounjaro says it's an injectable prescription medication indicated as an adjunct to diet and exercise to improve glycemic control with type 2 diabetes. Wegovy, package insert says, is indicated in combination with a reduced calorie diet and increased physical activity. Ozempic says, indicated as an adjunct to diet and exercise to improve glycemic control and reduce the risk of major adverse cardiovascular events in adults with type 2 diabetes and established heart disease. Let me say it louder. Weight loss should start with lifestyle changes for all patients, whether or not they're going to use medications. And look, it's not what you should do. It's identifying what changes you want to make and getting the help you need to eat healthy food, keep physically active, and see yourself as a healthy person. The key is a compassionate, empathetic, and holistic approach. Even 5% weight loss is enough to have profound benefits for your health. Not only can it enhance your quality of life by decreasing joint pain, improving your sense of well-being and your physical functioning, but it also lowers your risk of heart disease, sleep apnea, high blood pressure, high cholesterol, fatty liver, and of course, diabetes. Even mental health can improve by achieving a healthy weight. Now, of course, every single one of us is uniquely created. So what works for one may not work for your neighbor. You also need to understand that weight loss may happen fairly quickly at first, and then you may see a plateau. So to get over the next hurdle, you gotta do something different. And lastly, it's super important to understand this. When these medications are stopped, you will regain the weight unless you make significant changes. For this reason, obesity is considered a chronic disease, and when medication therapy is started, it's really supposed to be continued. But we live in a reality where side effects aren't tolerable for some people and others tolerate it just fine and lose weight, but then their insurance company says, yeah, we're not going to cover that anymore. It's expensive. And these drugs are definitely not cheap. There are some common side effects like nausea, vomiting, diarrhea, and loss of appetite, of course. People can get an upset stomach and acid reflux, as well as headaches and dizziness. More seriously, people can have kidney damage, pancreatitis, and gallbladder disease. Medullary thyroid cancer has been reported, but really, it's very rare. And because the emptying of the stomach is profoundly slowed down, there's been a sharp increase in anesthesia-related complications, such as aspiration. Increased heart rate has been reported, as well as mental health issues, including suicidal thoughts. To help with adverse symptoms, it's recommended that you start low and go slow. Let's go to mini medical school and talk about how these drugs work. Today in pharmacology, we are going to review GLP-1 agonist. Let's break it down and start with the word agonist. By the way, it doesn't have anything to do with agony. An agonist is a drug that enhances the intended response at the chemical level by looking like the protein, so the receptor thinks it's hooked the perfect fish. Well, not a fish, but I like visuals, so I thought I'd cast one out there. GLP stands for glucagon-like peptide. Cells have receptors on their surface that bind to certain proteins. The ones important for these drugs are the incretin hormones, and they're located in the gut. GLP-1 is actually made in the small intestine. The body secretes them after you eat, and that causes the release of insulin from the pancreas. Now, insulin keeps your blood sugar in check, and it helps your body use what you eat for fuel. And when this malfunctions, you have diabetes. What these drugs do is they block the hormone glucagon, which your body uses to raise blood sugar levels. So this keeps more sugar from going into your bloodstream. They also slow down digestion so that your body can't extract all the sugar from food, and that causes the stomach to empty more slowly. It also makes you feel more full and satisfied, so your body isn't screaming at you to eat more. There are 4 names for the drugs in this class. They're not that important, but they each work a little differently. And this is a fairly new group of medications, so research is still being done, and there are some promising things on the horizon. But the GLP agonists help manage blood sugar in people with type 2 diabetes and also help with obesity. And these are shots. And with either condition, you're supposed to make lifestyle and diet changes and not solely rely on medications. So let's go back and look at those package inserts a little more closely. Ozempic, which is semaglutide, the package insert comes from Novo Nordisk. There's a tab on their website with, quote, lifestyle tips. And the same drug company makes Wegovy, which is supposed to be used in combination with a reduced calorie diet and increased physical activity to treat obesity. And then there's Mounjaro, which is from Lilly Pharmaceuticals, and they say on their website that you should make lifestyle and diet modifications and that you should exercise. But I will mention that often these drugs are associated with loss of muscle mass, so sometimes exercise gets a little harder, and you can also lose bone mass, so it's super important to make sure you're getting proper nutrition while you're losing weight. So let's go ahead and talk a little bit about diet. This is too broad of a topic to discuss on one podcast episode, so stay tuned for more. But a low-fat dietary pattern with healthy carbohydrates, and what I'm talking about is fruits and vegetables and whole grains, is not associated with weight gain. And this was illustrated in a big study of almost 50,000 postmenopausal women who were randomly assigned to different diets. And the people who decreased their fat intake didn't gain weight, even though their calories were not restricted. We also see a lower incidence of heart disease and breast cancer in people who follow a low-fat diet. So, how do you get started on a low-fat diet? Well, you could meet with a registered dietitian and get a specific meal plan, or download some low-fat menus online. You could count fat grams, which should be less than 30% of your caloric intake. You could schedule an appointment with a board-certified lifestyle medicine physician. Our partner, Equilibrium Medical, provides telehealth care so that you can have a visit with your doctor from the comfort of your own home with no waiting and no interruptions. You must live in Arkansas or Tennessee to take advantage of this service. Visit www.equilibriumtelehealth.com to learn more. But let me just sum it up with this. Eat whole food. Eat lots of fruits and vegetables and whole grains. The variety will give you all of the micro and macronutrients that you need. Remember, the further away food is from its natural state, the less healthy it becomes. So let's talk about peaches. A peach from the tree, that's great. A peach knee-high? Well, there's probably not any nutrition in that. And there are lots of iterations in between the two. There are a lot of differing opinions on what constitutes a healthy diet. But I think we can all agree that a healthy diet does not include ultra-processed foods. So whether you're at a healthy weight and just trying to maintain your health, eat whole food. Or if you're trying to lose weight and do it on your own, eat whole food. Or if you've had surgery for weight loss, eat whole food. Or if you're taking the shot, eat whole food. And if you are taking medications for weight loss, congratulations, they typically work and they have so many benefits for your health. But if you can't stay on them forever, start now making lifestyle changes. Eat whole food. I love whole food, but one of the things that makes it hard for me to eat whole food is planning. Sometimes I wish somebody would just say, here, this is what you should eat for the next month, and here's a grocery list, and here are all the recipes that go with it. Well, that's a great idea. Stay tuned because you'll have an opportunity to sign up for that in the near future. So you don't miss any of these episodes where I talk about planning and whole food and exercise and how sleep affects your weight. Sign up for the email list so you don't miss a thing. There's some good stuff coming. But if you only remember one thing I said today, eat whole food, because that is the option that will make you healthy. And healthy looks great on you. The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.